So hello friends, we had lot of information from Dr. Sankaran, Dr. Milind Rao and my colleague Dr. Gaurang Gaikwad sharing different ways where you can approach the mind section and have your case successfully see through. So what I am here now to share is something interesting and something new. It is about direct patient language using ReferenceWorks. We'll see how it can help us. Basically, language is your thoughts, and thoughts are your direct expression. What you are saying is directly coming out in the expression of your thoughts. And it's very important to understand this expression, to understand this experience, and convert it into the easiest language possible. So I'll share some interesting cases, short cases about how different patient versions, the direct patient language, can take you directly to the remedy, to the simillimum, and help you all. So I have this case where this case was of halitosis in middle-aged man, and he enters the clinic like this. Doctor, I have very bad breath. So I asked, okay, what's happening? Then he again looks down. He was so shy and felt so bad about his complaint that he couldn't explain himself. Then he goes further and says, Doctor, when I go to office, I work less. I avoid talking to people. My wife, my colleague, all my friends, my nearby associates tell me that I have bad breath and they avoid me. Now I have also stopped talking to them, interacting with them. I really feel very bad. I don't stay long in front of them. And I really feel so hopeless because of this condition. And he again looks down as if he is so deeply saddened by the condition that he does not have any way out. Now, interesting thing is that the analysis part, when you see the case from the mind aspect, we see four main important things. One is what he said. What he said was, my wife and my colleague have said that I have bad breath. Second, what he says is how he said. He looked down. He expressed. He looked down. What he does in this condition, how does he adapt? He avoids people because of the fear of being embarrassed. They tease him, they avoid him. And how he does that? He doesn't stay with them for a long time. So when we unlock the case using the mind method, you have something known as PPP, which is present, persistent and predominant symptom of the case. And over here, if you see, it is embarrassment. He is looking away and he is really hopeless. So there is a direct patient language you have over here. The hopelessness feeling, the embarrassment, fear, and there is a meeting point of this direct patient language using ReferenceWorks. So we go to this simple search in ReferenceWorks. You see over here fear of being embarrassed. So I put over here fear 3 embarrassed 3 being, and in the same remedy hopelessness. And once I do the search, I have a super rubric created on its own. And you have 3 remedies, Ignatia and a lac remedy and the natrum mur. And then when you see the reference string, you have innumerable references for hopelessness. for natrum. Very beautifully explained. Now, when you go to your repertory and search for rubrics of hopelessness, there is no rubric because the repertory authors have considered hopelessness as a extreme condition of despair, and they have put all the remedies in despair. So you have directly from Hahnemann chronic diseases attacks of entire hopelessness and internal despondency, which take away all her strength. And from the latest book you have fear of being ridiculed, embarrassed. So beautifully this can be expressed through the direct patient language. I gave this patient natramune and he was much better. So you are bypassing the repertory. That is the beauty of your work, that you have endless possibilities to explore this case, and whatever is incomplete in your case you can complete it and have a meeting point in this program. Let me go over to the next case. This is a case of a 52-year-old lady. I think I had seen her last year, and she had a lot of joint pains. There were swollen joints and the redness of the joints, and she comes in little uh, in an awkward position, unable to walk, and she tells that, doctor, I have this hereditary problem. I was sure my grandparents, my mother, my father, everyone had it, and now I am also having it. This joint problem is always there in my entire family lineup. It's a hereditary problem. She came with her son and her grandson also. Now the grandson was very, what do you say, very active and very playful and very joyful, and kids are like that. So the kid, when they came and settled inside the clinic, the kid suddenly touched the lady's foot as if embracing her, and then she suddenly shouted, "Ah!" And then her son tells that, doctor, she is like that only. Earlier she was not so much shouting, so much shrieking. Now she is becoming very complaining type, and with the pain she has become even more complaining types. So what I found was, what she shared was very interesting. It's a hereditary problem. How she shared was, it was sure for her that it will happen. What will happen? What she does? She shouts, curse. She shouts at the grandson. अरे तेरे को समझता नहीं है क्या? She shouts at the son also. You're not giving me any medicine. No medicines are working. This pain is becoming horrible day by day. I cannot tolerate it. Again the kid touches her feet and she becomes, ah, don't touch it. I have told you. Arush was the name of the kid. She complains and laments this pain which is going on and on. And the son tells that, sir, please do something. She is becoming very angry and very lot of lamenting. She is there with the pains. She is complaining and we cannot tolerate her because of this attitude of hers. So what I found was something which is very persistent, which is very predominant in the case. One thing was superstition. She told that she is damn sure that it is happened to her because it's there in her family. This is a superstition, a fear, superstitious kind of thing. And what she does is she laments, she curses with her pains. So we have something interesting, the magic hand. She laments with the pains. So I put in ReferenceWorks, lamenting within 3 words of pains, and in the same remedy, superstitious fear. And once you see the result, you have only one remedy, roost talks. This is direct patient language distillation in the entire library you are having. And when I see the References, I have 8 references for this particular remedy expression. Very beautifully explained from 2 references. One is Allen's Handbook and the other is British Homeopathy Journal. Here it's written in Allen's Handbook, superstitious fear connected with the supposed presence of an agency of some invisible, sly, malicious being, something like that. And then the next, British Homeopathy Journal, an old lady falls down on the ice and dislocates her shoulder, and she, after few days, laments the awful pain and the sensation of stiffness in her shoulder. So this, the repertory makers may not realize that these things are present in some rare journals, some books hidden somewhere in our source books. But with the help of this program, ReferenceWorks, this will directly unlock your cases, the direct patient language which you will be using. And I gave Rust talks to this lady in 200 potency for few days, and in 15-20 days her pains reduced gradually and she's much better after that. Her behavior also improved. Let me show you some rubric about lamenting and pain from the latest repertories. You don't have Rust talks over here in the synthesis as well as in the other repertory, latest repertory. So that is the beauty of this program, that normally we are used to working in this way. We take the symptom of patient, we go to the repertory, we come back to the materia medica and read and then prescribe. It wastes so much of our time. Why not go directly to the source books, to the provings, to the case discussions, to the materia medica and all the library you have in the homeopathic literature, and also the repertory, as you can see over here. This is the way ReferenceWorks works. And you have everything in one place. The original provings, the materia medicas, the repertories, the case discussions, the latest provings, everything. Let me share a case of a nocturnal enuresis where you will see how latest proving has helped in this case. So this mother comes with the 7-year-old boy, and the mother says that sir, he is having a problem of urination at night. So I say okay, and by the time she is describing her complaint, the son's complaint, the son is climbing on the bed, jumping down and going out and coming inside and coming nearby me and seeing my table, and the mother says, sir, he is like that only, please don't get surprised, he is a super child for me. And I ask, okay, what is happening? Sir, he is very lively all the time, he is so energetic, he goes anywhere, he gets engrossed in all these things. He gets up in the morning, 6 o'clock, 7 o'clock he goes to school, 12 o'clock he comes back, then he goes to swimming school, so swimming class. I told him not to go. He told, no, I want to go, I will go. I want to learn swimming. He goes for 2 hours swimming, then he comes back, he goes to tuitions, and the child is still actively roaming in the clinic, outside, coming in and out. And mother says that in the evening then he goes out to play with his friends 3 hours. He does not sleep throughout the day. Until night he is playing, does some homework, comes back and the day, and he's a super child for me. So lively, very lively child. I tell, okay, tell me about what is his primary complaint about the urination. Doctor, he is not only active in the day but also at night. I ask how. Then she says that at night also, when he is about to pass urine, he makes some funny sounds, and then he passes urine. I asked him whether he sees any dreams or anything. Nothing is there. Just this moaning, and then he passes urine. So what you have is a revolutionary search over here. You have something direct distillation of the patient language. You will not find any rubric mentioning lively. These are just cross references given. There are just cross references given to this lively word in your repertory if you go and see. It will be maybe cheerful, it will be mirth, liveliness, hilarity, something like that. But here you will find exactly where liveliness is mentioned in our source books or latest provings. So you have over here lively, in the in the same remedy, amusement, three words, desire, and moaning while passing urine. So you put all the three symptoms together clubbed. And when you are searching from the entire literature, you have only one remedy, which is Crotalus cascavella. And I have this super rubric for this super child, what we see on the screen. So you go further and see the references, because that is what is important for us. So you see, in one of the provings of Dr. Sankaran, it is mentioned was smiling and a lot more lively. In Thompson's snakes, there is a mention about moaning and urination. And in Dr. Sankaran's latest provings of Crotalus cascavella, it is mentioned that this remedy has amusement desire for. So that is the best part. The original proving, the Thompson snakes provings, he is an author who has 20 years of practice and has all the provings. Ambra Gricia and all was his first proving, and these are the other provings which he has done. A long list of provings he has, and you have Dr. Sankaran's provings over here. So that is the best part, that you are having the old as well as the new, and you are combining it in your program, in your practice, and taking it to the next level. So you have direct patient language, the source books, and the exact match which you want in your practice, in your patients, in your library, which only ReferenceWorks can help you go. So some other rubrics of the mind, we are always used to referring some mind rubrics from the mind chapter of every repertory we are having. But there are some interesting rubrics which I can go on, say, for 1 or 2 days and explain you that how all different mind rubrics have their derivations from the source books. So why not access the direct source books? You have the rubric disconcerted. So disconcerted in ReferenceWorks will give you 10 remedies. It will give you some new remedy like urgentum sulfuricum, which is mentioned in Klein provings, and the remedy anguish terra, which is mentioned in the original book of Gunsi's keynote, having the disconcerted and irritated as least trifle as the symptom. So that is the best part. You see the other rubric I see over here on the screen is clinging grasp others. If you put this in ReferenceWorks, you have, say, I think 48 remedies, and there are a lot of Morrison carbon provings which has this mention, and also about digitalis, and many more other remedies mentioned in this patient expression in the ReferenceWorks. And when you see another rubric which is anguish weeping with, so there are cases where there is lot of pain in this patient, and while complaining about the pain, she is also weeping and as if she is in a deep anguish about the pain. And when you see this rubric in jar repertory, Kent repertory, Ney repertory, Murphy repertory, it is not having any such mention. But the complete repertory gives you some 5 remedies. The synthesis repertory gives you belladonna as one of the remedies. But when you see this direct expression in the ReferenceWorks, it will give you 30 remedies. And there are some interesting mention about agaricus, about coffea, about digitalis in Allen's handbook, Allen's encyclopedia. In the toothache chapter of hearing guiding symptoms for coffea, it has been mentioned that this patient has been driving frantically here and there because of this pain and anguish, and he weeps with the pain. Digitalis also has mention about it, about some other type of expression of this symptom. And these remedies are not included in the latest repertories. That is what I want to share with you all today. That this is going to be the most path-breaking thing if you are using it. The last rubric which I have is anxiety with sighing. So you have some patients, where they complain that there is lot of complaint they are having, and they get restless whenever they have to reach at time, and they get breathing problem. They sigh also with the complaints they express. And then you have this rubric where certain remedies are mentioned in the latest repertories, and you see the same rubric, same exact patient expression in reference works, and it is having more number of remedies. Say for example, anacardium from Allen's handbook. There is anxious sighing while asleep, while talking. Digitalis is mentioned in Hahnemann chronic diseases, having anxiousness with many sighs during the whole time. Veratrum album is mentioned in hearing guiding symptoms, having this anxiety and sighing together. So that is the best part of this program. I just explained you 20% of what is there, still 80% of it is yet there to explain you all. And that is the idea of synergy, that it will bring everything together. Your ideas, your practice, the way you practice, your process of practicing, and the technology which it has. And if you have your own books, own notes, you can add those also in the program. Your own seminar notes, your own seminar writings, which you are always jotting it down. So what I have for student and practitioners who do not have the software, who want to avail it, is something which is very cheaper and very low cost and economical for you all, which is the Academy Edition, available for Indian homeopaths at just rupees 10,000. You have so many repertories in the program: Bonning-Osen repertory, Boric, BTPB, the Murphy repertory, Fatak repertory, and lot of other books in the reference works also. All the 12 volumes of Allen's Encyclopedia, Herring Guiding Symptoms, Boric Materia Medica, and a list of long books, which all are source books and provings, which will help you extract the best out of your cases. So you can contact Dr. Pratik Jain. The email ID is mentioned over here. And also, if you want, you can just try it out about searching all direct patient language symptoms from the program using the trial version. The best program I feel is not only that will help you reach the simillimum, but also that will help you learn and empower your every growing day, your practice every growing day. And that learning and growth is possible only through the programs, because when we perform a search, when we get a remedy, we not only give the medicine, but we also learn something deeper about the remedy, and that is the source of inspiration for us all, and we all want to also inspire you all.